So we have the pleasure of speaking with Dr. Kwesi Blackman, an internal medicine physician and nocturnist at NYP Methodist in Brooklyn. He's going to tell us a little bit about his story, his path through medicine, and his unique perspective on entrepreneurship and health innovation. Likewise, he'll be sharing a little bit about his education consulting company, Healthcare Ventures, and how he's seeking to revolutionize pathways for underserved students interested in traversing into medicine. So, Dr. Blackman, without further ado, thank you for joining us today.
Pleasure to be here, Dr. Suji. How you been?
It's been great. I usually like to start these talks kind of just having you tell the audience a little bit about yourself, about how you came to find yourself in medicine. How did it all start?
Okay, my name is Kwesi W. Blackman. I was born in a country in South America called Guyana. I grew up here in Flatbush, Brooklyn, New York. After I graduated high school, I actually didn't do very well in high school. So I got left back in the ninth grade. Fought very hard to graduate on time, but I didn't get accepted to a lot of colleges when I finished high school. So I decided to join the United States Army. Just so happened to be my first day in the Army was September 11, 2001. The day the 12 fell. After that, I enlisted as a 13 Bravo, a field artillery soldier. I always wanted to be in medicine, but after I didn't do so well in high school, I thought that dream, I lost that idea of becoming a doctor. I didn't think I was good enough to be able to do something that big and grand with my life. After I joined the military, I was stationed at Fort Drum, New York. I was at upstate New York, and I was deployed to Iraq on 2 occasions. First from 2003 to 2004 to Kirkuk, Iraq, and then from 2004 to 2005 in Baghdad, Iraq. I was a combat soldier, a field artilleryman. After I finished the military, I finished my 4 years of service. I decided to leave the Army to pursue my dream of becoming a doctor. After I got out, I moved back to Brooklyn, New York, started at Kingsborough Community College, then went on to Northeastern University, where I got my bachelor's degree in biology, minor in psychology. And I attended the illustrious Howard University College of Medicine. I got my medical degree. My father passed away in 2015, so I decided to come back home to Brooklyn for a little while. I decided to attend Long Island University for my master's in business administration, took some time off from medicine. And I got accepted to residency at Kings County Hospital, SUNY Downstate, completed my residency in internal medicine. And now I'm a practicing physician at York-Presbyterian Brooklyn Methodist Hospital. And like as you mentioned, I am the co-founder of Complete Health Ventures, a healthcare consulting company that's focused on helping to educate minority students on the pathway to medicine.
That is quite the journey. So you jumped from enlisting in the Army to jumping into your medical education. Can you talk a little bit more about how you made that transition and what were some of the challenges that you faced there?
So definitely was a jump. It was a long, arduous journey. So when I was in Iraq, my second tour, I wanted to re-enlist. Well, I don't want to be a 13 Bravo no more. I didn't want to be a field artillery soldier anymore. I was 21 at that time, about to turn 22. I had bad knees, a bad back from combat soldier. We did very strenuous activities in the final war. One night I sat down and I thought about what I really wanted to do in my life, what I always wanted to become. And the answer came back to medicine. I wanted to be a doctor. But I was doing so well in the military. I had all these mentors helping me to grow and advance. I became a sergeant at the age of 20. I was doing very well. So I had to, one day, I didn't want to leave a career. Because if I stayed in the military, I could have retired at the age of 37. One night, I came up with the idea to change jobs. So from becoming a field artillery soldier to becoming a lab technician, because there's different jobs in the military.
Mm-hmm.
Fortunately, my mentors and the people that are the powers that be told me I couldn't transfer the jobs because I was too high ranking. And that greatly upset me. So I decided,
They felt like you would be taking a step backward if you went from like a high-ranking sergeant to becoming like a lab technician.
yes,
Is that right?
I was a high ranking sergeant in field artillery. And so if I was to be transferred to become a lab technician, I'll be a sergeant and a lab technician, but I would have less knowledge than someone below me because I was just
Oh,
not transferring into that position.
okay.
So that's the discrepancy, the issue that was there. So I got so upset that day that I said, I remember telling I was a cold Iraqi night, and I told my mentors, "I'll just get out and become a doctor." He said, "Become a doctor?"
Wow, just like that.
I was very angry that night because when they told me I couldn't change, I said, "I'll just become a doctor." He said, "Do you know what it takes to become a doctor?" I remember saying, "I don't know, but I adapt and overcome." And that's and we'll figure it out. So when I got out of the army in 2005, I moved to Brooklyn. I got my own apartment. I was living by myself. I was 22. I didn't know where to start. I didn't have any family members in medicine. The internet wasn't as robust as it is now with material to tell you the path. But I knew I had to get a bachelor's degree. I knew I had to go to medical school. And so I started at Kingsborough Community College, and I just started there. I knew I had to go to college. So I
Mhm.
finally could smart college. My experience going from a sergeant in the military to a student was a very drastic change for me. I was very militant when I got out, being in the military for so long. I was in for 4 years. I didn't have the mind of a 22-year-old, yet everyone treated me as a 22-year-old, it was very difficult
Mhm.
to position to be in. But I did well. I just stuck to my books. I know I had to do well in school because, grades mattered when you get for medical school. And my whole focus, my whole mindset was do well, graduate quickly, and move on to the next phase, which was for me was a bachelor's degree.
At this point in your education, you're pursuing an associate's, and then your goal is to move on to a bachelor's degree. And where did you pursue your associate's again?
So yes, exactly right. It was Kingsborough Community College. It was a small community
Okay.
college here in Brooklyn, New York. So I started with my associate degree. Then I moved on to my bachelor's degree at Northeastern University. The experience was very challenging for me, especially at first it was a transition from being in the military to being a college student. But the thing about Kingsborough is it had a lot of non-traditional students. So we had students from that older students, younger students that just not finished high school. They had a couple of veterans. They had older adults that were coming back to school. So it was very mixed, non-traditional. And then when I transferred to Boston, it was a completely different experience. I was 25 or 26 at that time when I started my bachelor's degree. So I was going through the internet and I found Northeastern University. It was a good school. It had a pre-med program where the school would write you a letter of recommendation if you did well for medical school. I just found on the internet that it was a good school. Like I said, I have really good mentorship or someone to direct me to what's the best school to go to. I just heard Northeastern was a good school. I got accepted, and I went.
Okay.
So that experience was different than Kingsborough because Northeastern, there were a lot of young students, very young students. Like they just not graduated from high school. They put me in a dorm for the first semester I was there. So I had roommates that were like 17, 18. Like it was a completely different experience than being in Brooklyn. So
And
after
so
that,
how did you kind of cope with that?
no, that's a great question. I cope with that by throwing myself into my books, by into doing well in school, focusing. Like I didn't really have any parties or anything. The only like social life I really had was one of my good buddies from the army. He had just not gotten out also, and he moved to Boston, and he became a Boston police officer. So I would go to his house and hang out with him and, go out with him when I wanted like some downtime. And I would come back to Brooklyn sometimes. I still have my apartment in Brooklyn. And then when I went to Howard University, it was completely different.
Okay, hold
Tra-
on. We're gonna get there, but I want to unpack this. I want to just make sure I unpack this for everyone listening. So, you went to LIU, did well, finished in Northeastern, and then now, how did you find yourself at Howard?
So again, I didn't have any direction. I didn't know that you're supposed to take the MCATs I think, your junior year of college. I didn't know that, so I didn't take my MCATs my junior year. I took my MCATs my senior year of college. So when it was time to apply to medical school, I was a year off. So I graduated in 2009, and I didn't start medical school in 2009. I had to delay because I didn't take the MCATs late. So I moved
But
back
did
to
you
Brooklyn.
apply?
I didn't apply that year because I didn't have the so I moved back to Brooklyn, and I actually got a job at the Department of Defense at Fort Hampton in Brooklyn, New York. I was working in what we call a military entrance and processing station. We call it MEPS. It's the exact same MEPS I was in process through when I joined the Army. So I worked there for a year, Department of Defense, and then I got accepted to Howard University, College of Medicine. I applied, I interviewed, I came to DC, I did a great interview, I toured the school, I loved it, and I got accepted.
And was Howard the only place that you applied for med school, or what did the rest of
No,
that process look like?
I applied to 25 schools. I got
Okay.
uh, 2 interviews, and I
Okay.
went to 1. I got,
Really?
yeah, and I got
You only went to Howard? Your Howard interview? Why didn't you go to the other? Can I ask what
that's
the other, maybe it doesn't matter, but
it was the other one was Meharry,
oh, no.
and
Still a great institution.
I didn't wanna
Nobody
go
wants
all the
to
way
go
to
to Harris,
I
though.
didn't want I didn't I'm from New York, and I didn't really know much about down south or Tennessee or where Meharry is located, and I didn't wanna fly all the way to Tennessee. So I said if my idea was if I didn't get accepted to Howard, I would try again next year. I had a
Wow,
good job, I was doing okay financially. I could have taken
that's
I could fly next year.
got it. Okay. That's one hell of a bet. But so do you think that it's like kinda like a recurring theme, actually. So you think that the fact that you had kind of something to fall back on made it a little bit easier for you to make a decision where you would end up in a place where you would feel more comfortable as opposed to just, like, taking whatever was given to you in a way? You had the liberty to make the decision to say, well, you didn't go to an interview. A lot of people would not do that. A lot of people would go to every single interview that was offered, but you said, "You know what? This is the school that I really am interested in of the interviews that I got. Now I'm gonna forego the other one. If it's not Howard, then I'm just gonna try again next year." A lot of people would have said, "Well, I'm gonna go to every single interview," but your choice, you made a little bit of a different choice. So can you speak on that?
At that time, I was away from my family a lot. I was in the military, I was upstate New York, I was in Boston. My mother and father got divorced when I was in Iraq, so I wanted to be around my mother, close to my mother, and going to Tennessee was just a bit too far for me. DC was a 4-hour drive from New York. I could go back and forth. When I was in the military, it was a 6-hour drive from Brooklyn to upstate to Fort Drum. I would even that back then, I would go back and forth. So DC was closer.
So there was, like, a level of familiarity with the idea of going to Howard that made it more enticing option. Okay, that makes sense.
Some friends that I served with in the army in DC also. So I
I
had
see,
people out
yeah.
there.
So you had people there. Okay, that makes sense. Did you know anything about Howard before you got there? Like, outside of, like, the ties that you had there?
Absolutely nothing. I know it was a HBCU. Other than that, not much else.
Okay. Well, so then you get to Howard, and then what's your experience like?
With the transition from Northeastern to Howard, at Northeastern, I was only black student in several of my classes. Then when I got to Howard, Howard was very intimidating to me because of some of my classmates, a lot of
Really?
my class. Yeah, they're very, very intelligent, very, very intelligent. But you gotta think of medical school, everyone there earned their seat. Everyone there has to be smart, right?
Mhm,
But
mhm.
also, I got the sense of the difference in economic differences in within the students, and
Mhm.
there were so everyone was black, but not everyone was the same, I guess, because they had some students
Yeah.
that were first generation. I'm a first generation doctor. I never been, no one in my family was a doctor. They had
Mhm.
kids there where my mom's a doctor, my grandfather and grandmother are
Yeah,
doctors. I'm a generational doctor. So
yeah,
coming from Brooklyn, where we're Afro Caribbean descent, we're not poor, but we're not socially wealthy.
sure.
There was I never seen that level of wealth in some of the students that my classmates. It was different economically. I don't you understand what I'm trying to say?
Yeah, I completely understand. Yeah, different levels socioeconomically, like, yeah,
Yeah,
for sure.
and, Howard is they I learned Black excellence, and it is, generations of doctors, lawyers, a lot of, dentists. So I made friends with a couple of people that were, similar to me, came from similar backgrounds that I'm still friends with to this day. it was intimidating at Howard. Some of my classmates and the intelligence of some of my classmates. I remember they had this one guy. He had like photographic memory. Just stare at a book and
Yeah.
he would know the USMLE. And well,
Yeah.
I struggled to figure it out.
So what were some of your coping mechanisms and just, being in the midst of so many brilliant people? I went there too, had the same thing, had the same photogenic memory
You know,
learners will hear a lecture one time, go and spit it out on the test. Yeah. So, but what were some of your coping? Did you study with them? Did you develop your own study habits? What did you do?
I studied a lot on my own. I wish I knew about YouTube and stuff like that back in around that time to help
Yeah.
you facilitate my learning better. I just locked myself in. I did the same thing I did at Northeastern, which wasn't always good. Sometimes I didn't pick up on stuff. I fell back on some of my classmates, the really smart ones. They would come help me out. We'd study together sometimes. That's how I did it. I struggled, but I eventually got it. Medicine is unforgiving sometimes. The
Oh,
medical
yes.
way, sometimes they expect you to get this stuff very quickly. And even right now, I have some residents that are not picking up on stuff very quickly. And it's a process. Some people have been doing this stuff for 20 plus years. You need that time, and not everyone works at the same speed. They need people that help them through.
That's very true. Just because I know a little bit about your story personally, you speak pretty openly on challenges with test taking during your time at Howard. Can you speak on that a little bit?
Definitely, I struggled with the USMLE. I didn't achieve a passing score on my first attempt, and it broke me. I worked so hard to get into medical school, and then when you see the fail on their transcripts, that it broke my confidence. I worked for years to get to medical school, and then I not to think about once you get to medical school, the challenges it takes to get through medical school. So that impacted me a lot. I buckled down. I studied. I finally passed the USMLE, and I moved on. But failure is not fatal. It's ability to push forward, to move on. That's persistence, right? Resilience. These are the things that make you get to where you want to be and help you get through things. Even when I was in a residency, my first year of residency, we got hit by COVID. But for my first 6 months of residency before COVID happened, I was struggling, and none of my attendings helped me. They just looked at me like, you better figure it out. In my mind, I thought you were my supervisor, you're my attending, my leader. Aren't you supposed to help me figure it out? And so that experience helped make me the kind of attending I am right now, where I help residents. Like I don't pimp no one. If you don't know the answer to something, I'll tell you the answer.
Yeah.
So I'll tell you what. At Howard and at Kings County, I used to hate when attendings and senior residents would say, "In the literature says this, the literature says that." What literature are you reading? Where do I find this literature? What exactly do I go read? You just keep on saying the literature this, the literature that. Which literature? So right now, like I just not told a resident like a day or two ago, he really didn't know how to manage sepsis. And I told him how to manage sepsis. I told him I don't pimp anyone. I'll tell you the answer if you don't know the answer. For the first couple of times, I'll tell you the answer so you know the answer the next time. And then I told him to go read Surviving Sepsis. And that's the literature that you need to learn how to manage sepsis.
Sounds like you're a very empathetic attending, and I'm sure your trainees are very grateful for that. It's probably a welcome respite from some of your
They,
colleagues.
they, I tell them they have it a lot better than I did when I was a resident at Kings County Hospital.
And so,
Luckily, like I said, I struggled during my first 6 months at Kings County. But after when COVID hit, I had to step my game up very quickly because
hmm,
it was I had to take on a lot more responsibilities, even as an internal medicine resident back in 2019 when COVID hit. We were stretched so thin that I remember I went to a rapid response in this patient, and I got to the rapid, and because we were short on doctors, pediatricians were taking care of adult patients. And my senior, she had to go to another rapid. A patient was coding, so she went to lead that code, and I went to the rapid. Then I walked in the room, and they had the pediatrician attending. They had pediatrician residents, the nurses, everyone looking at, standing and looking at the patient. I said, "Who's leading this rapid?" And they looked at me. I had to step up because I had more experience running rapids as an intern than they on an adult patient than they did.
Yeah. I mean, I was there too. It was a very difficult and trying time. I want to kind of tie everything together. After you passed your step exam, did you have similar challenges with step two, step three? And then you mentioned that the first 6 months of residence or intern year were difficult. How did you remedy that? Where did you go for you said that you didn't really feel like you got the support that you should have gotten from supervising attendings at the time. So how did you remedy that? What were your support systems? Where did you go to be able to circumvent that?
So regarding the steps, I struggle with step one and I struggle with step two. Every time I struggled, I developed test taking anxiety. I still have test taking anxiety to this day. I did well on step three. The way I coped with those struggles was to throw myself in the books. When
Wow.
yeah, I just studied harder. My answer to everything was I think I need to study harder. But it was actually more psychological. I think I started developing test taking anxiety. So to the point when I even though I spent 2 years in Iraq fighting a war, when I walked into the Prometric Center, I would start having anxiety, like top palpitations, and
Yeah.
I would push through, and I didn't do as well as I could have if I was more open about the struggles I was going through, I was facing.
Mhm.
Uh, Same thing in residency. You know, start to doubt yourself. Should I be here? Especially when you're surrounded by intelligent co-residents that catch on to this stuff very quickly. During their
Mhm.
first month in residency, they're doing everything correctly. Then you're not having the supervision that you need. You get anxiety, and am I supposed to be here? They call it
Mhm.
what's it called? When you imitation. What's the word when you don't think
Um,
you should
imposter
be there?
syndrome? Imposter
Yeah, that's
syndrome?
it. Imposter syndrome. Yeah, I was dealing with a lot of imposter syndrome when I was a resident. When I became a resident. Should I be here? Let's just be here. Am I intelligent enough to do this stuff? And I hoped that someone around me said, "Yes, you are. You can do this." Luckily, I was in Kings County, SUNY Downstate. I was from Brooklyn, so in the clinics, we have inpatient and then have clinics. In the clinic, I was surrounded by patients that were from my neighborhood, and that made them very comfortable with me. I saw my patients in the clinic, and that relief helped build my confidence when I was in the clinic. Then when I got to the wards, I was doing inpatient. I was slowly building my knowledge base. I would go back and read. I took everything back to the basics, how to do a HPI, a history and physical exam. I thought my way through everything. Every problem I would separate and figure out how do I treat this, how do I assess this problem, what's the plan for that problem. As far as social, at that time, I had my fiance at that time, and I had my son. So had that when I went home, I was home. I only lived a few blocks away from the hospital, in the house that I grew up in. I was in the neighborhood I grew up in, and I started slowly building my confidence. So the imposter
Awesome.
syndrome, it
Amazing.
was so at the end of my residency, as a third year, I was operating as an attending. Like my attending would come. I remember Dr. Sabu John. He would just come and I would lead our rounds. I would lead everything, and he would just sign a small note, attestation. It was like a one or two lines. And I always used to joke with him. You think I'm ready for the short note? Because my notes would be long, our HMP, and he would just like two sentences. And at the end of
Oh,
eval- at my evaluation, he wrote "ready for the short notes."
ah, I love that.
So
Wow.
when I became attending, it was like natural for me, and it's still natural. It's been almost 3 years since I've been attending.
That's awesome. That's awesome. So, well, I guess so now we're at the end kind of the medical training. So, tell me a little bit about I'm going to ask about what you're doing now to kind of keep up, what you're doing in terms of, resident education and your role as staff attending and actually your faculty with NYP and Wiley Cornell and what your I mean, I know about Complete Health Ventures, but I'd love if you could share kind of where the inspiration for that came in and how you're incorporating that into your roles, your many hats now.
Definitely, definitely. So during my first or second year of residency, started noticing that some of my co-residents weren't treating the patients very well. They didn't see the patients as people. They saw them as sickle cell patients, COPD patient. And there were some of them that says some very negative things about the patients, not knowing that I'm from Brooklyn. The patients were from my community there, or me. So I said, what's the problem? Why can't we get better residents? Better residents that care about this community, that stay in this community after. Because a lot of them, as soon as they finish their residency, they leave Brooklyn. They come and they get the best training in the country, and then they leave. They don't support the community. They don't stay here. A lot of them. Some of them do, but a lot of them don't. And some attendings that were very, very vicious, very mean. And after doing my MBA, I was thinking about this, and I said, this is a personnel problem. This is a human resources problem. We need more diversity in medicine. We need more doctors from the community. Why don't we have that? Well, there's not a lot of doctors in growing up from Flatbush. I knew there weren't a lot of doctors in my community. Who do the people that where do children that are interested in medicine go for guidance and direction? When I was a high school student, I didn't have anyone to talk to. No, there were no doctors in my community I could go talk to. And doctors felt like this person in the ivory tower I can't get to. When I go to my doctor's appointment, I see they're doing their thing, but we don't engage in conversation other than asking me questions about medicine. I can't strike up a conversation with my PC. By that time, with my PCP, I didn't even know what a PCP was. I saw my doctor maybe once a year just so I can get my written off for my annual physical. So I wanted to create something where students have access to doctors, like real access outside of the hospital, where they can ask questions, they can get guidance. A lot of my classmates at Howard had family members in that were doctors. My nieces, one of them was interested in medicine, becoming a doctor one time. Then she changed over to become a nurse. But even then, she had access to me, and she could call and ask me questions. She even comes over sometimes right now and studies at my house. So I want to be the uncle to every student that was interested in medicine, every student that didn't think that they can achieve the goal of becoming a doctor. When they see me, they see my team, where we're full of doctors that are not traditional doctors, like traditional backgrounds. Some, took the traditional pathway, but many haven't. Some had struggles to show people that becoming a doctor is not all glamour. People struggle. I struggled, and I still am where I'm at today. Right. That's why we created Complete Health Ventures to become the uncles of people that want to become doctors. So they don't have they don't have a doctor in their family, but they have a doctor in our program, and that's how they can connect to the medical community. Because the medical community is just like any other community; it's very small, and you need help to get connected to us. Because not everyone can reach out and touch a doctor. Not everyone can pick up a phone and call a doctor. Like I look at my son; he knows a lot more doctors than I knew at his age of 6. And that I wanted that for everyone else's children, just like I had for my child. That every child that wants to become a doctor, I want that for them. Something that I didn't have, the mentorship, the direction. Like I told you, I fumbled my way through a lot of this stuff, Northeastern, Howard. You told me I should have went to the Tennessee to interview.
I didn't say you should have. I just said other people probably would have. That's
Yeah.
all. Don't put
And
words in my mouth. Like,
looking back now, other people with the correct guidance, mentorship would have listened to their mentor and said, it's not a good idea not to go to that interview. And if I had someone in my life to tell me that at that moment in time, I guarantee you I would have went to that interview. Just so I would have the option. I would have seen, thinking back, maybe I should have went to the Tennessee to get a new view. One thing I realized growing up, exposure is very important. And I didn't have a lot of exposure when I was a high school student. The military exposed me to a lot. But if I needed a lot of exposure in high school, that's the other reason why we do this stuff. And for high school students, we do college students and we also do junior high school students. But exposure to doctors, to people that went through different processes to get where they're at, that's major. That's eye-opening. And even when we do our workshops for the high school students, for the college students, even if they don't decide to go into medicine, the ones that say firmly, I'm not going to do all that. That's a lot of work. It opens their eyes to the process so they get an idea of maybe not right now, but maybe 4 or 5 years from now, they're sitting in their bed and they're thinking, what can I do with my life? Oh, I want to become a doctor. Oh, I know the process. I remember back in high school, the doctor came and spoke with us about the process instead of not knowing anything. So we're hoping that our program at least drops those nuggets in their mind that they can use further when they're a little older. And the ones that know what they want to do, we're here to mentor them. We're here to support them.
that's awesome. That's just incredible. You guys are doing very amazing work. Been to some of the workshops and just a very awesome experience that you're providing. In terms of the test taking anxiety, because I think that's something that a lot of people really struggle with, whether they're academically strong or not. I have family members that struggle with it. It's just really something that can be a big barrier in terms of progression. So, you mentioned that you delve into your books, like, you just jump into the books, but, like, is there anything else that you would maybe recommend if a mentee or trainee came to you and said, I feel like I really understand the material. I'm doing great in terms of my management of my patients, but when I get into the test settings, I just, for whatever reason, I freeze. What would you recommend?
To be honest with you, I have not fully gotten the answer to that question.
Mm,
I'm still working on it every day. I work on it.
mhm.
I don't know. I'm this honest
That's fair.
answer. I try to focus on. I keep on coming back to the material, even though I know the material. But you can go to therapy. There are people that specialize in helping you to be better test taker. I took a course in Florida that Howard sent me to. It was called the PASS program at that
Okay.
time, and that really helped me. They taught me test taking techniques and stuff like that. How to read read the answers, read the last sentence, and know how to break it down. And some of these tests, it's not even about the material. It's just about
Yeah.
your test taking skills, how to process of elimination, and you get to a point where the test is bigger than you. You think you see the test bigger than what it really is, and you think that
Yeah.
the test is trying to get.
Yeah.
I remember the first time I took the steps, I was thinking, oh, the answer can't be that simple, and I would talk myself out of the right answer. And
Yeah.
then inside the program, they said your first answer is usually the right one, and they would
Mm.
sit down with me, and my tutor would make me go through the test, and the first answer I took, I couldn't stop and talk myself out of it. I said, "That's you're not leaving. That's the answer. Go." And I started doing that. Yeah,
That seems like a
I
well,
did. Yeah, sometimes you talk yourself out. Sometimes you're better than you think you are, and I think that's a lot to do with that imposter syndrome. Now think about it's about where I grew up, the path I took, the struggles I had
mhm,
that I had to go to get
mhm.
where at in medical school and residency, maybe if I didn't have to face those challenges, I wouldn't have that anxiety. And I think about other students in my class having that same kind of mentality of struggle. And I see, so I go through a lot in my mind. And, even when I was a high school student and ability to speak to a doctor, I would get anxious because I'm not allowed to talk to the doctor, the person in the white coat, and it was just a buildup. Nah, I think about my son and how he's surrounded by doctors and how easy it is for him to go talk to anyone. And he would never have the challenge that I faced. If he decides to become a doctor, his father's a doctor, his godfather's a surgeon. He has, tons of doctors. I don't know where my anxiety stemmed from, but I know he won't have the same anxiety and same issues that I had. And that's like I said, I want that for every student that I teach, every student in our program, every one of my residents, because it all comes down to sometimes the sense of I don't belong here, the imposter syndrome stuff, and
Yeah.
you sometimes and majority of times you do.
What general advice would you give to trainees and maybe somebody who's on a less traditional path listening to this discussion, this discourse? And sub question to that, because you said something very interesting earlier in terms of you wish you would have been more open about some of your struggles. So I would like for you to possibly unpack that. And then I'll ask my last question. Yeah, but let's start with those two.
So I noticed throughout my process that we don't in medicine we share our successes, but we don't share our failures
Very good.
because just like in everything, everyone thinks that everyone else is doing well. Everyone has been amazing. And in my mind, all my classmates were excellent. They were doing great. And in reality, a lot of people were struggling. I remember our class started with like 114 people and ended like less than 100. A lot of people got kicked out. A lot of people
Yeah.
didn't survive the process.
Yeah. You don't
Uh,
remember I don't know if they said it to you at the beginning, like on your during orientation, look to your left, look to your right. Somebody
yeah,
won't be here by the end of the year. They
yeah,
were right.
they
They were right.
well, unfortunately, they were right. But
Yeah.
this is a process. This is a journey. I wish I enjoyed the journey more than I did. I wish I, got to meet more people, got to know more people than I did. I did get form some bonds, but the process of learning stopped becoming enjoyable to me at a certain point where the joy of medicine, being a doctor, I lost that. Like during residence, not during medical school, when it was more like I was in survival mode than enjoying the process. Try not to get into that mentality. Try not to get to that point. Try to have a life outside of medicine. Medicine is great. I love medicine. I love my job. One of my mentors, his name is Dr. Robert DeWitty, and you can see this a photo of me and him in the OR at Howard. And we were talking one day, and he told me something that always stuck with me to the point where when I made this picture, you can't see, but it's what he told me that day. It says, "My work is not my life. I work to maintain the lifestyle I want to live." So he loves medicine too. He loves surgery, but medicine is not his life, and he always said that. To me, at one point, medicine became my life. Medicine was everything to me. I had to go well in my classes. And then when my father passed away in 2015, I realized I didn't spend a lot of time with him because I was so engulfed in this process. Luckily, he was at my white coat ceremony and he got to help cloak me. He saw his son become a doctor, but medicine became everything. So in this journey, make sure you take time for your family, for your friends to be someone outside of medicine, right? Don't let medicine define you, become the only thing about you. And it'll help decrease your anxiety because if you're surrounded by doctors and these high achievement people all the time, it'll make you feel down on about yourself, which I did sometimes. And if you have family and friends around you, you can, go away from this medicine world in normal life, I guess. I think when I was a resident, I got to see my patients that were from Brooklyn, that was from my community.
So what is the next thing that you have going for Complete Health Ventures, for your career? Do you have any projects that you're working on? Anything that you're excited to be moving towards that you want to share?
Definitely. So for Complete Health, my full-time job, actually just finished 12 nights on my job.
Yes.
So I'm gonna be off for the next 2, 3 days, and I go back on. Work is settled, but outside of work, Complete Health Ventures has grown, and it's gotten into areas that I never even thought about. Would get into. We became a consulting company for a group of primary care clinics where we obtain specialists to come speak at their grand rounds for them. We do mentorship sessions for college students. I'm about to start a health talk series with a local organization out here in Brooklyn called the Gentleman's Factory, where I bring in specialists and have a fireside chat with an interviewer for the community of it's mostly Black men in the community consortium of Black men. So I'm working on that series. I want to give back to the community to make sure that, when I saw all the people that were dying during COVID, people that were dying of like basic illnesses like asthma and diabetes, they were dying. I remember a 34-year-old guy, he passed away. When he got admitted, he was having short respiratory distress. Then his oxygen levels went down. He was intubated. He passed away before I got back the next day. And that really wow, there's a lot of anxiety in our community, a lot of PTSD in our community. So we need to talk about these things. We need doctors that are engaging in the community, and not a lot of doctors do that. A lot of doctors come, they do what they're trained to do, which I don't know. I don't want to shame anyone that does it. They come, they do their job, they stay in the hospital, and they leave. But for me, I want to be able to connect the community. Since with all this training and all this knowledge that I have, and all these connections that I have too, I know doctors from all around the country in different specialties that, some doctors want to connect to the community, but they don't know how to. So Complete Health Ventures is that pathway for them to just hop in and hop out. They can hop in, do a workshop for us, for the community, and then they can go back to their, well, I can't say 9 to 5, they can go back to their jobs as a physician in the hospital. And it's also a different atmosphere. It's different seeing a doctor in the hospital versus in the community. You can talk to them more freely, ask questions. And a couple of workshops that I do is also how to talk to a doctor. What questions to ask. Some people get intimidated by talking to doctors because they don't know what questions to ask their doctor. So when I do like my diabetes workshop, at the end, I have a list of questions to ask. Ask your doctor, what's your A1C? Just don't nod along. I tell them about paternalism. Doctors are advisors. I always tell my patients, I'm an advisor. Just like you go to a mechanic to ask about your car, you come to me to ask about your health. I'll advise you. You make the final decision on your health. I advise you. That's why sometimes it's upsetting when patients say, I'm not doing so good. Fix me. You know, I, it's not if you're not taking the medication that I advise you to take, that I prescribe you to take. If you're not, diet and exercise is huge. And a lot of people in our community think pills are the answer. And sometimes don't even take their pills. So diet and exercise is the best medicine. I always preach that. Unfortunately, we don't have the spaces. We don't have the culture of exercise. You don't see a lot of young Black kids not running in the park. Our
Anymore. Once upon a time.
our community is being gentrified, and there's a lot of others that are running and taking advantage of the park that was there for years. And so there's a park. There's different things that you can do. There's different foods you can eat, and they say we live in a food desert, which is true. It's hard to find fresh food around here, but you have to educate the people. That's one of our goals at Complete Health Ventures, to educate the community.
Amazing. I said that was going to be my last question, but actually, I have one more. I think it would just be for somebody who has like a more entrepreneurial spirit, because that's not really super common in medicine. People just kind of go in, get their training, and then they just want to practice, which has its own slew of problems once you get into practice. But that's a whole nother discussion. And you know that because you have an MBA. But for somebody in medicine interested in entrepreneurship, what would be some of your advice to them?
My advice is find a problem and find an answer. The problem I saw, if there's no problem and everything is moving fine, go ahead and just practice medicine. For me, I saw a problem in the way that residents were treating the patients and the disconnect between the doctors and the patients, and how so
Mhm,
few of the high school students and the students here in Brooklyn were going into medicine as a career, thinking it's too hard, it's too expensive, all these reasons they were giving for not pursuing medicine, even if they thought it was interesting, right?
mhm,
So that was the problem I saw, and I saw it from my own perspective because this is the community I grew up in. And then you think about, how do I solve this problem? What can I do to solve this problem? Is there something I can do? And if there is something you can do, look into creating an LLC, creating a business, right? There's a lot of business grants. There's a lot of America is the land of opportunity because of businesses, capitalism, right? And you just have to figure out how you fit into this process of fixing whatever problem is coming. One of my colleagues, a year or two ahead of me in residency, he was very entrepreneurial also. His problem that he found was the way we find sources. Like sometimes
hmm,
we would go to Up to Date, we would go to different websites. So he created a program that would bring everything together into one app,
mm,
the information. I think it's called Able MD or something like that he created. And he created an app. He got support from the institution, the faculty at downstate. He created the app, and he's doing very well. And he's not even I don't think he practices medicine that much, if at all. He
wow,
threw into his business. So he saw a problem, he developed a fix for that problem, and he pushed forward with it. And luckily, he had people in his life to help support him through that process. Sometimes you don't get that support. Sometimes you might have to keep on pushing until someone sees the benefit and decide to help you. But you have to believe in yourself more than others believe in you at sometimes.
that's very true. Okay, Dr. Blackman. Inform, inspire, and mentor.
Yes. Inform, and that's our motto.
That's your motto. It's amazing. Well, I want to thank you for sharing your story, sharing your insights, sharing your perspective. Just an incredible journey. And thank you again for your time, especially after 12 nights straight. Yeah. Thank you.
Anytime.
Squared.